Hello everyone, I'm Dr. Ben Caplan. I specialize in the field of medical cannabis. Today I'll be answering 3 questions about medical cannabis that have come up on different social posts I've done recently. Question number 1 comes from Instagram. What are the 3 most common medical conditions that can be treated with cannabis and how does it help? First of all, for anyone left in the world who thinks cannabis is a new thing, happy to share that humans have been using cannabis for medicinal needs for at least 12,000 years. That's the end of the last ice age when Jericho was a new settlement and humans were just starting to domesticate animals as well as plants. Across time, cannabis has been found to be beneficial for a huge array of different medical conditions. The most common ones include chronic pain, which affects millions of people worldwide on a daily basis. Difficulty sleeping is also at the top of this list, and then a wide variety of mental health challenges. Things like PTSD, anxiety, depression, and a bunch of other behavioral challenges. How does it work? Cannabis works by interacting with our body's endocannabinoid system, which plays a key role in regulating pain and mood and overall balance of our wacky signals and hormone communication systems. Different components of cannabis, like THC and CBD, interact with the system in different ways to provide relief. Question number 2, this one's from Twitter. Can you explain how CBD and THC differ in their effects on the body and why someone might choose one over the other? Absolutely, great question. This one comes up all the time. THC, or tetrahydrocannabinol, is the compound in cannabis that mimics a natural molecule that we're all born with called Anandamide, which is responsible for its psychoactive effects, things like joy, calm, the feeling of satisfaction, contentment, what people often refer to as the high, although I think that word overflows with bad connotations, experimentation, guesswork, feelings and experiences that must feel more like the loss of control than anything comfortable or stable. THC, or anandamide for those that are enjoying this experience without the plant, can be effective for pain relief, helping us recenter ourselves, improve appetite, reduce GI upset, all the same reasons a doctor might advise you to find your happy place or enjoy stillness or calm with or without a plant to help. On the other hand, CBD or cannabidiol doesn't cause the same effects that we think of as euphoric, although it's still very much helpful to support the calm and peaceful effects that THC does through very different mechanisms. CBD is known for its therapeutic properties like reducing inflammation, anxiety, and helping to regulate healthy sleep cycles. So why would someone choose one over the other? Patients may choose CBD if they want the medical benefits without the dramatic alterations that come with THC for conditions or times of day where the absence of a high is more appropriate. Unlike its sister molecule, CBD does not seem to bind to the same happy receptors as THC. Instead, CBD is believed to prevent some of the binding and breakdown of a naturally produced molecule called 2-AG, 2-arachidonyl glycerol. Say that 2 times fast. So that there's more of the 2-AG floating around, causing whoever took the CBD to enjoy the effects of calm and satisfaction from 2-AG and their own natural anandamide. Believe it or not, all of these systems, the endocannabinoid system, anandamide, 2-AG, these are new medical discoveries since the late 1980s and early 1990s. So we're talking 30, 40 years that we've known about them at all. Although it's pretty obvious that these molecules are core to human life and satisfaction and happiness, we are still in the earliest stages of understanding any of this stuff and where its place is in the body and the human experience overall. That's partly why so few people seem to know much about it anyway. Question number 3, this one's from Instagram too. What are the most common misconceptions about medical cannabis that you encounter and how do you address them? One major misconception is that medical cannabis is simply a cover for recreational use. While my personal take is that most use of cannabis can be seen through a lens of having some therapeutic value, it's totally reasonable to think of medical cannabis as being used as intentional, controlled doses toward treating certain medical conditions with specific formulations, or to work towards a healthier you in the future. Another common myth is that it's highly addictive. While it's true that like any substance on earth, cannabis can be misused, the reproducible rates of addiction are consistently way lower compared to almost any prescription medication, on the order of 9 to 11%, same like coffee or exercise. Compared to opiates, benzodiazepines like Ativan, Valium, and Xanax, those are 3 to 5 times more addictive. So we're talking low addictive range overall. It's important to approach cannabis with an open mind and a scientific understanding, recognizing that like anything, it has potential benefits alongside potential risks when it's used without guidance or understanding. Thank you for joining me for this quick Q&A. I hope you found it helpful. I'm under the impression that education and understanding are key to improve the world of medical cannabis. If you have questions or thoughts, share them and stay tuned for next time. Thanks for watching.